Hello everyone, can you hear me? Can you please type in the chat whether you can hear me or not? Once there is a good number, we'll start with today's session. Actually, I came in a short notice. I just thought I will just give you a short session on the osteology of mandible. Mandible is actually a very important topic for MBBS as well as BDS students, and of course for other specialties as well. And mandible is a favorite question for examiners as well. So I just thought I will give you a brief description about the bone in the session, and after that, in the next session, I will be dealing with the clinical aspects of mandible as well as some of the applied aspects. So in this session, we will be discussing mainly about the important aspects of mandible. So are you ready? Let's start today's session. Can I get some of your feedback so that I can start the session? Okay, so we'll start today's session, that is mandible. So when we talk about mandible, the term mandible is derived from a Greek word which is known as mander. Mander, the Greek word means to chew. So that is how it is derived from the Greek word mander. And in Latin, it is derived from the word mandibula. Mandibula means the lower jaw. So that is how the word mandible is derived from. Okay, so you have the Greek word mandia, which means to chew, and the Latin word mandibula, which means the lower jaw. Now, we will see first the peculiarities of mandible. So, what are the peculiarities of mandible? We know that mandible is a U-shaped bone, and it is also considered as the lower facial skeleton. So, if you consider the entire face, it is considered as the lower facial skeleton, and it is said to be the largest and strongest bone of face. Okay, so it's said to be the largest and strongest bone of face. So, these are some of the peculiarities of mandible. Now, which are the main parts of mandible? You have the body of mandible as well as two rami of mandible. This is the body, and these are the two rami. Uh, I don't know whether you can type your chat. Okay, so if you are able to type, you can type in the chat, or else we'll discuss it later. Okay, so anyway, we will finish this topic. So you have a U-shaped bone, and it is forming the lower facial skeleton, and it's said to be the largest and strongest bone of face. Now it has got a body and two rami. Singular is ramus, and plural you call it. If there are two, you call it as rami. So there are two rami and one body. First, we will discuss the body, and then we will move on to the rami. So when we talk about body, what is the shape of the body? When you look just at the body of mandible, you can see that this is just horseshoe shape. Okay, horseshoe shape. And you have to discuss the body under two main headings. One, you have the surface, and the other one, you have the borders. Surface means you have the external surface as well as internal surface. External surface means the surface which is projecting outwards, and internal surface means which is in relation with the oral cavity. So this is the external surface and this is the internal surface. And talking about the borders, there is an upper border and there is a lower border. Okay, so there is an upper border as well as lower border, and there is an external surface and an internal surface. Now let's see what are the features you get in the external surface. So external surface, we will start from the midline and we will move on to the posterior aspect. So in the midline, you can see a faint line, okay, in the midline. That is known as symphysis mentae. So what's the significance of symphysis mentae? Symphysis mentae means the mandible is formed from two halves and later it got fused along the midline to form the symphysis mentae. Now, just below the symphysis mentae, you can see a triangular projection or triangular elevation. This is known as mental protuberance. Okay, so you have the symphysis mentae, which is in continuation with the mental protuberance. So the apex, this is a triangle, and the apex of this mental protuberance is actually in continuation with the symphysis mentae. So these 2 points you have to remember. That means the midline you have the symphysis mentae, and below that you have the mental protuberance. The importance of mental protuberance is this is actually more prominent feature of human jaw. Now another important thing is mental tubercle. So on either side or the lateral angles of this mental protuberance, you will get the mental tubercle. Okay. So the lower angles of the mental protuberance, you call it as the mental tubercle. So mental tubercle along with the mental protuberance, you consider it as a feature of human jaw. Now, just lateral to it, you can see a foramen that is known as mental foramen. Again, mental. So, where will you locate this mental foramen? That is very important. So, from midline to lateral aspect, you know there are two incisors, sockets for two incisors. Then you have one canine. Then you have two premolars. Okay, so along the second premolar, in line with the second premolar, sometimes it can be seen between the first and second, but here it is seen in line with the second premolar. You can see the mental foramen. And what passes through the mental foramen? You get the mental nerves and vessels. So these are the structures which passes through the mental foramen. Now, moving medially, we just discussed about the incisors. Just below the incisors, you can see a fossa that is known as incisive fossa. So, which are the muscles seen attached to the incisive fossa? One group going to the lip and the other group going to the chin. Going to the chin, you call it as mentalis. This muscle is known as mentalis. And going to the lip, you call it as orbicularis oris. So, these are the two sets of muscles which you get in relation with the incisive fossa. Now, if you move laterally, we are discussing the body of the mandible. You can see an oblique line. Can you make out an oblique line? This is actually in continuation with the anterior border of the ramus of the mandible. This is the oblique line. And this oblique line is actually ending at the mental tubercle. Okay. So this is actually ending at the mental tubercle. And from before backwards, if you just keep three fingers from before backwards, you can say three major muscles attached along this oblique line. Anteriorly, you have depressor labii inferioris to the lip, which depresses the lip. Then the middle finger represents depressor anguli oris, which depresses the angle of the mouth. And posterior most, you have the buccinator. So keep your three fingers over the oblique line, and these are the important muscles which you get from before backwards. That is depressor labii inferioris, then you have the depressor anguli oris, and followed by buccinator. Now, another important thing is this is the body and this is the ramus. So at the junction of body and ramus, if you keep two fingers, you get two important vessels, that is facial artery and facial vein. So which is anteriorly lying? You know, A comes anteriorly. So facial artery will be anterior and facial vein will be posterior. So that is seen at the junction of the body and ramus of mandible. Now, so these are the important features which you can make out at the outer aspect of the body of mandible. Now, we will move on to the internal structure, internal features of the body of mandible. So the first and foremost thing which you can make out in the internal aspect is the myelohyoid line. Can you make out a line similar to the oblique line over the outer aspect? you have an oblique line that is known as the myelohyoid line. So from where to where you will draw this myelohyoid line? So the third molar. So from behind the third molar, you can trace this line towards the midline. Okay, so this is the myelohyoid line. And what is the feature of this myelohyoid line, or what is attached to the myelohyoid line? You have the myelohyoid muscle attached to the myelohyoid line. That important point you have to remember. Now, in relation with this myelohyoid line, you get two important salivary glands. So above the myelohyoid line and below the myelohyoid line, you can see a region above the myelohyoid line anteriorly and a region below the myelohyoid line posteriorly. One important thing which I would like to mention at this point is the mandible is actually seen in close relation with three major salivary glands: parotid, submandibular, and sublingual salivary glands. So all the three important glands are seen in close relation with the mandible. That point you have to remember. So in the inner aspect, the region below the myelohyoid line, you call this region as submandibular fossa, just below the mandible. That is the word meaning, submandibular fossa. It is here when you palpate. Okay, so what are the structures seen in this submandibular fossa? From the word itself, you know it is the submandibular salivary gland. Then there is one important artery which we have already discussed. This is how the facial artery comes to this region. So facial artery. Then of course the gland is seen closely associated with the lymph node, that is the submandibular lymph nodes. So these are the structures which you get in the submandibular fossa. Now above this myelohyoid line, you will get anteriorly a region that is known as sublingual fossa, and there you get the sublingual salivary gland. So these two important regions, above and below, anteriorly and posterior to the myelohyoid line, you have to remember. Now again, when you look closer, there are small projections on either side of the midline on the lower aspect. So, what do you call this region or these small projections? They are known as the genial tubercles. Genial tubercles. So, you have a set above and you have a set below. So, above you have a major muscle attached from this genial tubercle to the tongue. That is known as genioglossus. And below, a group of tubercles is giving attachment to the hyoid bone, the muscle, to the hyoid bone, that is known as geniohyoid. So since the hyoid is lower, it is geniohyoid, which is attached to the lower set of tubercles. And since the tongue is above, to the upper set of genial tubercles, you have the genioglossus. So genioglossus above and geniohyoid below. That also you have to remember. Now, so we discussed about the major glands, myelohyoid muscle, then the genial tubercles. Now, if you trace to the posterior aspect, just behind the myelohyoid line, along the posterior aspect, you have two important muscles attached. One is the superior constrictor of pharynx, and the other one is pterygomandibular raphe. So these are the two important structures which you get here: superior constrictor of pharynx and the pterygomandibular raphe. And one important nerve which is seen in relation with the muscle, that is the myelohyoid muscle along the myelohyoid line and the superior constrictor, there is a narrow gap where you get the lingual nerve. That important relation also you have to remember. Now we will move on to the borders. So just now we discussed about the external surface, internal surface and its features. Now we will move on to the borders of the body. You have the upper border. Upper border is also known as alveolar border. Why? Because you have the sockets for the permanent teeth. So you have the alveolar border where you get 16 sockets for 16 permanent teeth. And they are actually cavities. Sometimes they will be septate according to the architecture of the tooth which it contains. So there are 16 sockets on the superior border or the upper border or the alveolar border. Now, lower border of the body is considered as the base. Base means something on which it rests, isn't it? So, this is known as the base of mandible. Now, when you look closely along the base of mandible, there is a small depression. towards the anterior aspect. This is known as digastric fossa on either side of the midline, smaller projection, smaller depression. This is known as digastric fossa. And what is attached to the digastric fossa? If you consider it like this, you have the anterior belly of digastric attached onto the digastric fossa. Okay, now again, when you talk about the lower border, along the lower border, you have the attachment of one deep fascia. So when we talk about the deep fascia of neck, you know there are mainly three layers. They are the investing layer, pretracheal and prevertebral. So the investing layer of deep cervical fascia is getting attached along the lower border, and just to the outer aspect along the lower border, you have the platysma attached. These are the two important structures which you should remember. So that's about the upper border and lower border. Now we will move on to the ramus of the mandible. So ramus of the mandible, again, you have to talk about surfaces of the ramus as well as the borders of ramus. When you talk about surfaces of ramus, there is an lateral surface. If you keep it like this is the lateral surface and this is the medial surface. When you talk about the borders, there is an anterior border, there is a posterior border, there is an upper or superior border, and there is a lower or inferior border. So these are the important borders. So four borders and two surfaces. And apart from that, for the ramus, you have two projections. Can you make out these two projections? The anterior projection, the triangular projection, is known as the coronoid process, and the posterior projection is known as the condylar process. So coronoid process as well as the condylar process. So these are the important landmarks which you can make out for the ramus of the mandible. Two surfaces, four borders, and two projections. Now let's see one by one. So first we will talk about the lateral surface. So lateral surface, you just remember the Prime Minister, PM. Posteriorly, you have the P, that is the region related to the parotid gland. And the rest of the regions, M, that is masseter. Again, when you think about mandible, it is the bone which mainly helps in chewing, isn't it? So all the important muscles involved in mastication, that is temporalis, masseter, medial pterygoid, lateral pterygoid, all these four muscles will get its attachment to the mandible. So we'll be seeing it one by one. So lateral aspect of the ramus, posteriorly you have the parotid gland, Prime Minister, and the rest of the regions you have the masseter. Now when you talk about the medial surface of the ramus, you can see a small foramen, isn't it? Can you see a foramen which is actually getting in continuation with the canal? So this is known as mandibular foramen, and this is in continuation with the mandibular canal, and this will run like this and will make its exit through the mental foramen. That is how you get its continuity. Mandibular foramen, the canal, and it will come out anteriorly through the mental foramen. That also you have to remember. So this is the mandibular foramen and canal. And what passes through the mandibular foramen and canal? You have the inferior alveolar nerves and vessels passing through the mandibular foramen and canal. And it is actually guarded by a tongue-shaped projection. At the mandibular foramen, you can see a tongue-shaped projection. So tongue means the word is in relation with the lingual. So this is known as lingula. This projection is known as lingula. And what is attached to this lingula? You have the sphenomandibular ligament. From the sphenoid bone to the mandible, there is a ligament known as sphenomandibular ligament. So what's the applied aspect of the sphenomandibular ligament, especially for the dental people? They will open the mouth and they will feel for the sphenomandibular ligament so that they can locate this foramina and the location of the nerves, the inferior alveolar nerves, so that they can give the block. So that is the importance of the lingula, the attachment of the sphenomandibular ligament and its relation with the inferior alveolar nerves and vessels which are passing through the mandibular foramen. Now, between the groove, there is a groove just below the mandibular foramen, that is known as the myelohyoid groove. This is for the myelohyoid nerves and vessels. Just below the mandibular foramen, you can see a groove that is for the myelohyoid nerves and vessels. So between this groove and the angle. This is the angle of mandible, isn't it? Posterior border and inferior border meets to form the angle of mandible. This region on the inner aspect gives attachment to medial pterygoid. So medially it is the medial pterygoid and laterally it is the masseter. So we finished two important muscles, medial pterygoid in the inner aspect and masseter on the outer aspect. Now coming to the upper border. Upper border you have the mandibular notch through which you have the mesenteric nerves and vessels passing. So this is the mandibular notch between the coronoid process and condylar process, and this is for the mesenteric nerves and vessels. And the lower border, this is the lower border. Anteriorly it is in continuation with the base of the mandible, and posteriorly it is in continuation with the angle of mandible. So that point also you have to remember. Anteriorly it is continuation with the base, and posteriorly it is in continuation with the angle of mandible. So we finished the lateral surface, medial surface, superior border, inferior border. Now coming to the anterior border. Anterior border, this is in continuation with the oblique line, and above it is in continuation with the coronoid process. So what is attached along the anterior border? You have the temporalis muscle, the third important muscle, the temporalis muscle along the anterior border and the medial surface. That is the muscle which you get along the anterior border. And what about the posterior border? Posterior border P. P stands for parotid. So this is in relation with the parotid gland. So that's about the ramus, the external surface, internal surface, anterior border, posterior border, the upper or superior border, and the lower or inferior border. Now coming to the two processes, one is the coronoid process and the other one is condylar process. The levels of the two processes and how you determine the age, what are the applied aspects and all, I will be discussing in the next session. For the time being, you have the coronoid process anteriorly. This is just a triangular process. And again, we have already mentioned about the temporalis muscle. This will come and get attached also over the apex and the medial part and margins of the coronoid process. So coronoid process of the mandible, just remember temporalis muscle. Along the margins, along the medial aspect and to the apex, you have the temporalis muscle. Now coming to the condylar part. Condylar part is otherwise known as head of the mandible. So with which bone it will articulate? So you have the temporal bone here, you have the mandible here. So with the temporal bone, it articulates to form the temporomandibular joint. So when you see the head of the mandible, you can see that it is elongated horizontally. It is not anteroposteriorly elongated, it is elongated horizontally. And it is articulating with the temporal bone to form the temporomandibular joint. So if there is a head, what follows? There will be a neck. So here also you get a neck for the condylar process. And what is attached along the neck? You have the capsule of the temporomandibular joint attached along the neck. Now laterally along the neck you have the lateral ligament of temporomandibular joint. Laterally you have the lateral ligament. So laterally you have the lateral ligament of temporomandibular joint. Then there is a depression. This depression anteriorly you call it as pterygoid fovea. This depression is known as pterygoid fovea, and that is for the lateral pterygoid muscle. So that is the fourth muscle, important muscle. So pterygoid fovea, you get the lateral pterygoid. Medially you have the medial pterygoid. Laterally you have the masseter, and the anterior border and the coronoid you have the temporalis. These important attachments you have to know. Then one important relation along the medial aspect of the neck, you have one nerve and one artery. Okay, one nerve and one artery along the medial aspect of the neck of mandible. That is, the nerve is auriculotemporal nerve and the artery is maxillary artery. So auriculotemporal nerve and maxillary artery. So this is about the different parts of the mandible as well as the important muscles and vessels seen in relation with it. Hope you had a quick review about this bone. The applied aspects and other important aspects I'll be discussing in the next session. Please do keep watching, and I'm sorry the chat session was not working. Anyway, you can leave your comments in the comment section. Thank you. Thanks for watching.